So I want to ask you something. If you've been told your blood sugar is high, or you've got pre-diabetes or type 2 diabetes, how many times have you tried to do something about it? And I mean really tried. So cut out sugar, switched to wholemeal, done the NHS course, joined a slimming club, bought the cookbook, downloaded the app, and said no to the biscuits at work for 3 weeks running, and then struggled. Maybe couldn't keep up with it, had a binge, struggled with cravings and gotten fed up, only to try again, and the same again, and find the cycle repeating. And who's had the experience of going back for that blood test with your doctor, hopeful that yes, there might have been slip-ups, but overall, over the past weeks or months, you have made changes. You have been better. You have said no to the things, and the blood test number? It's barely moved. Your weight, maybe it's shifted just a bit. What about for some people finding that number has even gone up a bit? Because I see it really often as a doctor. In clinic, I see the people that I spoke to 3 to 6 months earlier about cutting sugar out, and then I have to deliver them bad news that their lifestyle changes have not done enough, and now they need tablets. And I see it. I see the disappointment, how perplexed they feel, how confused they are about what to do next, because the majority of people do not want to take tablets. And the reality is, most people believe that they can't avoid them after a while, or so they think. I'm Dr. Nerys. I'm an NHS GP working in West Wales, and I'm the founder of the Lifestyle Clinic. I founded this clinic because I got frustrated. Frustrated with 10-minute appointments that couldn't hold the conversation that actually needed to happen. Frustrated with watching people follow advice and get nowhere. And eventually frustrated with myself because I ultimately was the one giving that advice. And I started asking why. Not why aren't people trying hard enough, but why is this not working? And the answer, when I finally found it, had almost nothing to do with willpower and everything to do with one small organ that nobody in that 10-minute appointment ever had time to explain. And this video is here to share some of the good news that can come from shifting your approach and perspective. Because when you see this through the lens of that little organ that lives underneath your stomach, you start to really understand how to help heal from within. But first, I need to present a completely different way of thinking. I've been helping people reverse diabetes for 10 years now, and I want to present a new idea. What if this was a game? So stay with me, because this is really interesting. If I offered you £1,000 to beat me at chess, having never played, what's the first thing you would do? Probably learn the rules, right? Obviously, you'd study the game. And if you lost and I offered you £2,000 for a rematch, you'd hopefully come back with a different and better strategy. So why, when it comes to health, do we go back to exactly the same strategy every single time? When things don't go to plan, we blame ourselves, our willpower, our discipline, our personality, but never the strategy. Isn't it interesting how if we put money value to a challenge, it sharpens our focus and makes us think outside the box? But health, it doesn't ignite us in the same way. Unless I ask you this, what is the value of your health? Put it in money terms. How important is it for you to be without tablets? Think of a money value. To be without fatigue, low self-esteem and loss of control. How much would you pay for that? What is it worth to have more energy, to increase your lifespan, to spend time with your children? Put a value to it. How much money is this worth? And then think, if you're about to enter into this game, how would you then go about it? Would you learn some rules? Would you learn about that little organ that sits underneath the stomach? Well, of course you would. So let's go there. Let me introduce you to the game of diabetes reversal by introducing you to my little friend, the organ I advocate for every day, the pancreas. Now, this organ is quiet. He never complains. He works hard, really hard. He takes on more and more and more and never says a word. Did you know that at the point of diagnosis of type 2 diabetes, only 50% of the cells that control the blood glucose are actually functioning well, and yet you haven't felt any different? The majority of people I see are shocked to be given their diagnosis because the pancreas hasn't particularly complained. Imagine only having one lung working or half a brain. You really would know about it, right? And it's so interesting. What type 2 diabetes is an organ burning out. It's exhausted and it needs help. Now, have you ever seen a colleague burning out? So a person drowning in work or overwhelmed. Maybe you've even been that person. If you've got more work than you can manage, you stop being efficient. You start making mistakes. You lose control. And eventually you stop functioning. And when you stop functioning, the work overspills and you eventually have to stop working altogether. This is the pancreas. The workload is sugar or glucose. It's a tricky job keeping the levels of glucose just right. Not too low as to feel dizzy and unwell, and not too high as to cause inflammation and damage the cells. But the modern diet gives us so much glucose, and this might not be intentional glucose. So much of it is hidden, and you're unaware of it. Now, this is not your fault. It's not your fault that for decades the amount of sugar and sweeteners and processed food has filled us all with glucose. We've been putting our pancreas under a huge amount of strain, but you feel no different because the pancreas is not complaining, only when it is completely overwhelmed. By the time somebody gets the type 2 diabetes diagnosis, by the time the numbers are high enough to show up on a blood test, the pancreas has often been struggling for years, often decades. So here's the thing. Every diet you've ever tried, every slimming club, every app, every Monday morning reset, none of them were designed with this organ in mind. None of them were asking, how do we help the pancreas rest? How do we reduce its workload? They were asking, how do I lose weight? How do I decrease fat? How do I cut calories? The problem is the pancreas cares nothing for calories and fat. The pancreas is struggling with glucose. And that's a completely different question, which is why they keep giving you a completely different results from the one you actually need. You have been made to believe that this is a willpower problem, that you're not trying hard enough. What I am saying is, it is a strategy problem. And the moment you start seeing it that way, the moment you stop blaming yourself and start asking the right questions, is when everything shifts. Your blood sugar starts to move. The evening cravings start to quiet. And for the first time, you are not fighting your own body. You're finally working with it. Because there is a way to help that organ. It is a game of strategy that is different to what you've done before. And it starts with understanding that just a handful of things that nobody in that 10-minute appointment ever had time to explain. And when people understand them, really understand them, they see their blood sugar drop. I see medication stop. I see energy return in ways that surprise people, sometimes within weeks. And it's not because they've suddenly found willpower they didn't have before. It's because they finally understood the game they were playing. And here is what I know now, from sitting across from the people who told me that they had tried everything and had nothing left. When I ask them to think differently, when they finally understand what game they are now playing, they come back and they tell me they can't believe the difference that this shift has made in their numbers, in their energy, in the way they feel at 9 o'clock on a Wednesday evening. And that really never gets old. In the next video, we're going to go deeper into this game, into the rules, and specifically the foods we eat every single day and what they are actually doing to your blood sugar. The answer will probably surprise you, so I'll see you there.